So we've had some successes just in terms of some of the appropriations, authorizations, new legislation being introduced. What else are you looking at in 2023 or that you're keeping your eyes on?
Sure. So, one of the big areas of activity in 2022 was around something called PDUFA, the Prescription Drug User Fee Act. And this is another authorization bill. It's been passed for many years. And while the larger bill allows the FDA to charge user fees to fund many of its important processes and programs, we in the children's cancer community really follow this closely because where we can pursue a lot of our policy goals. And this is a very key area for us. And that is around, improving the drug development process for children with cancer and Steve, I'll kind of let you talk a little more about the issue, underlying issue. But the bottom line here is that PDUFA, as we call it, did pass last year. It was a relatively more narrow bill than prior years in the end of the day. So many of the items that we worked on, we helped draft an agenda that then the Alliance for Childhood Cancer adopted. And then we worked Children's Cancer Cause to get some of these things included directly. And as I say, a much more narrow PDUFA was passed. So we're going to be looking to get some of these goals looked at again in the 118th Congress around creating parity for children in the drug development environment, et cetera. And I'll let you add to that too, Steve.
Yeah, no, thanks. It's been an exciting time over the last 5 years for our community. When the RACE Act was passed in 2017, the Research to Accelerate Cures and Equity for Children Act, it really said to companies if there is a molecular target that they see for children, they must conduct evaluations of that in the same way they would do for adults. And I think that while the RACE Act has just gone into effect over the last 3 years, one of the trends that we're going to be looking at is to see how effective it has been. So the Government Accountability Office, or the GAO, is going to be issuing a report on the initial implementation. But we do know that historically, pediatric evaluations for drugs tend to get deferred, and the FDA does allow that to some extent, but ultimately the studies have to be completed. And right now we know the FDA can issue non-compliance letters, but they're not always that effective. They go up on a website and don't really carry a big stick, but the ability for the FDA to levy civil monetary policies on adult drugs is something that they can't or aren't authorized to do right now under the law for missed pediatric evaluation. So we kind of think that that's an inequity that needs to be addressed. And we're also just very cognizant that the FDA has all the resources that they need as the RACE Act goes forward, because we know that more drugs are being evaluated and more submissions are coming forth. So this is something we're keeping our eyes on as well.
That's right, Steve. Yep. Thank you. I'd like to mention a couple other items too that we think are really important for our community in this Congress. And as I said at the beginning, we basically do a reset where we start over, Congress starts over, and all bills have to be reintroduced. So there's several key policy proposals that were not adopted last Congress that we're interested in, and I would say the whole childhood cancer community is interested in. And I'd just like to highlight two of these. One of these is the Gabriella Miller Kids First Research Act. This is something that's been around for a while and provides very important research dollars, non-controversial consensus legislation. So presumably, hopefully we'll see that move through this year. And then another item, the Accelerating Kids Access to Care Act. This is legislation we've long supported, and basically this would allow for Medicaid portability. So when you're diagnosed with cancer as a child, very often you'll have to go to another state for treatment because really it's considered a rare disease, and you know, regardless of where you are, you're quite likely to have to go to a center somewhere else. And often the Medicaid coverage in your state is what covers you, and it's an administrative and burdensome process to get this transferred. This bill would really get rid of a lot of those burdens so that it's a much more seamless process to get that Medicaid coverage wherever you're treated. And it's something we strongly support.
Yeah, I couldn't agree with you more, and especially with nearly half of all patients being under Medicaid, this could be incredibly important. Just wanted to add as we close that we have several lobbying days coming up that we're going to participate in, and if you're interested, come to the Children's Cancer Cause website and you can get more information. But the first will be in early March with One Voice Against Cancer, and we're going to be going out and advocating for continued funding at the NIH and NCI and CDC. And then in April, the Alliance for Childhood Cancer will be holding its lobby days. So we have some great activities for people to sign up for. And, I think, again, it goes to the importance of that personal appeal to our leadership and the role that each individual can play with representatives in their community. So anything else you want to add? This has been a great conversation, and I'm so glad we could get together.
No, thank you so much. I agree. It's been a really illuminating, productive conversation. And I look forward to a great first year, first session of the 118th Congress.
Great. Well, I'm sure we'll see you again soon on Conversation Series. Thanks, Sue.
Thank you.